waiting 30 days for a doctor's appointment when you need one, spending $10,000 per American every year as a society on healthcare. Is this a system that you want for yourself, for your children and your grandchildren? It doesn't have to be this way, and today I'm going to tell you why. In the last 300 years since the signing of the Declaration of Independence, we have gone from horse and buggy on one hand to almost colonizing Mars. And nearly half of the innovation that's occurred during that time to change our lives has happened since 1970, in and around our lifetimes, and we've been lucky enough to witness, participate in, and actually drive that invention. But more important than just the act of invention has been how we've learned to use these things to improve our workplaces, our homes, and our lives, to be able to actually use them to do more with less, to become more productive, everywhere except in healthcare. And that's what I'm here to talk about today, the issue of productivity in healthcare. For the purposes of my talk, and for the report that we wrote on this topic, we define productivity as output per given unit of input in healthcare services delivery. And we define output as the number of services that we are able to actually deliver to patients who need them. So with that in mind, let's get started with the numbers. Between 2001 and 2016, healthcare delivered 9% of overall GDP growth, and as many of you know, GDP is the strongest indicator of the strength of an economy. So 9% of GDP growth and 29% of the US's workforce growth. So put another way, one incremental employee in healthcare was 1/3 as productive as an employee anywhere else in the US economy. How can that be? Well, in order to understand it, let's actually look at the drivers of economic growth: labor, capital, and multifactor productivity. Many of you are likely familiar with the terms labor and capital, but how many of you are familiar with multifactor productivity? Just raise your hands. Wow, surprising, there are a couple of you out there. Yeah. So it doesn't really roll off the tongue, but multifactor productivity is a term that we use to indicate the contributions made by technology, innovation, and other things that we just can't measure. So now that we know this, let's take a look at how healthcare and a couple other industries contribute to economic growth. So when you look at this chart, you'll see that in healthcare, all of our contribution to GDP growth comes from labor, so just adding more bodies. Now, if you contrast that to the goods industry, you'll see actually the opposite pattern. In healthcare, multi-factor productivity, that innovation and technology, actually has a negative contribution to GDP growth. The goods industries are actually opposite, so that multi-factor productivity, as well as capital investments, are actually driving growth there. Think of robotics and automation in manufacturing, for example, that allows a lot of us to have the various gizmos and devices that govern our lives these days. So what's going on in healthcare? How can this be true? Let's take a look at that gray bar to understand a bit more about what's going on. So when you actually look at the healthcare delivery space, you'll see that in healthcare, for every one core clinical staff member, we have 4 support staff. Okay, so 4 people for every one, physician or caregiver equivalent. And here we're just looking at other service-type businesses like healthcare, and you'll see that we're leaps and bounds beyond other services industries. Now, sometimes people think, oh, it's because we need so many specialized staff in healthcare, right? But that's not actually true. Half of those support staff have skill sets that are meaningfully undifferentiated, industry agnostic from other parts of the economy. So there are probably a whole host of reasons that underlie why this is, but one of them might be the fact that we have a lot of regulations in this space. Second only to the Treasury, and that's actually saying quite a lot if you think ahead to tax season. Even more surprisingly, those regulations have grown quite a bit in recent years, so 35% during a recent time period. Now, obviously, there are some regulations that help us and keep us safe and ensure we have high-quality care, but which ones are actually helping us versus hurting us? Now, all of this brings us to the real problem, the one that we read about almost every single day on the front page of a newspaper or magazine: our overall spending in healthcare. And many of you are familiar with the fact that we're spending more and more every year, and the growth rate is actually outpacing the growth rate of the US economy. we're actually on track to hit 20% of US GDP by 2027. 20%, a fifth of the economy. What's interesting is when you actually break up the different parts of the healthcare system, you see that there are different parts that are growing at different rates. And there are two that really stand out if you look at the right-hand side here. Healthcare insurance administration, so all of those costs related to billing and insurance, and then outpatient care, which also happens to be a very large area of spend. So let's take a look at each one in turn. So health insurance administration. Some of the reasons why the US spends so much on this is because of just the structure of our system, right? So we happen to be in a country where we have multiple payers and multiple providers, and not everyone else is like that. And payers, on the one hand, are doing their best to ensure that they are the best stewards of the money that flows through them. And providers are doing their best to ensure that they're actually well paid for the services that they provide. Having worked on both sides of the aisle, so to speak, we estimate that if everyone were just to put in place the best practices that we already know about today, so no massive changes to the structure of the system, we would save between 10 and 25% of the spend in this area. I just want to let that number sink in for a second, 10 to 25%. I know it sounds huge, but it's actually less than some of the other estimates that exist out there, for example, through the Institute of Medicine. So I think we can all agree that if we want to be serious about addressing healthcare costs, this is an area that we can't afford not to look at. So now let's move to the outpatient space. I want to start by looking at our most precious resources, physician and caregiver time. And how many of you in this room are physicians or are training to be physicians? Again, just raise your hands. Okay, so we have a few of you out there. I'm sure you, like many of my friends who are physicians and me as well, get calls all the time from your friends and family saying, why does it take so long to get an appointment in specialty X? Or is there any way you could help me get in with Dr. Y? You know, the soonest I can get in is 2 months from now, right? What's going on? When we actually look at the national data around this, we see that wait times are variable across the country for sure, but are pretty high. Dermatology runs in the 30-day wait time, along with family practice. Cardiology and OB in the 20 to 25-day range, and orthopedics in the 10-day range. Now, I get that derm is rarely same-day serious, but how many patients in this day and age should or can be willing to wait 30 days to see a primary care doctor in a family practice when they need to see one? Even more unnervingly, how many patients should be willing to wait 20 days to see a cardiologist when they have some symptom that has caused a primary care doc to say, hey, you should really go get that checked out by a cardiologist, right? And how can that coexist with what we know to be true about physician schedules when you look at the chart on the right-hand side here? Each red arrow represents a patient appointment, and the white is space between appointments. And I know that contrary to popular belief, physicians are actually human and need to do things like eat lunch and take breaks, but even that can't explain what's going on here. And this is retrospective data, so this is after having taken out all those patients who actually never showed up, and only during the clinical time. So what are doctors doing? They're chasing down faxes. They're making phone calls to find prior auths. They're doing a whole host of things that they frankly did not go to training to do. So physicians, how can we free you up to doing what you came to medicine to do, which is to actually see patients during the time that you have allocated to seeing patients? And how can we actually harness the tools of productivity like scheduling and automation to actually help patients get in front of physicians when they want to? What's really amazing is what this would look like if we were actually able to do it. Most of you are probably familiar with the fact that we have a massive projected physician shortage on the order of tens of thousands of physicians according to the AAMC by 2030. And those are what you'll see on the left-hand side bars here. Now, we know from looking at national data that physician schedules are full, again, retrospectively, when you've taken out all those people who never showed up, to about between 78 and 82%. So if we were able to bring that up to 95%, so not aiming for perfection here, right, 95%, we would essentially eliminate that shortage, as shown by the right-hand side bars. And that's productivity, actually allowing people to do the jobs that they train to do and see patients, and giving them the tools to be able to do that, instead of just adding more and more people and more cost to the system, which is then translated to higher prices for all of us. There isn't anyone in this audience who doesn't work in healthcare, is there? Anyone? Oh, a couple. Okay, so I'm about to let a couple of you guys into a dirty little secret that we have in healthcare. The fact is that many of the things I've talked about today, we've actually known about for a long time. And we've actually chosen, whether explicitly or implicitly, to not really do anything about it. I'd like to challenge us on how to be bolder. I'd actually like to challenge each and every one of you, whether you're a student or already well into your career, to go back and think about this problem and not just recognize that it's actually a really big deal, but talk to your colleagues and your institutions about how you can appropriately invest in addressing the solutions, and not just through pilots, but actually scaling solutions that'll help us address some of this. And I'll tell you why it's important. So 40 years from now, when my kids hopefully have kids of their own, and I'm well off into lovely retirement, I want a life that's better for all of them, and also for me and all of you in this room. What's that going to take? Productivity. Let me explain. So over the last 40 years of our lives, we've actually gotten used to a rate of growth in our standard of living, our quality of lives, and we've actually been able to double our standard of living in the last 40 years. So we're all used to that now. If we just take that same rate of doubling standard of living over the next 40 years, okay, so we're not aiming for some crazy new rate, we will need to achieve real GDP growth of 2.4% in order to do that. We know from demographic data that the workforce is only going to grow 0.5% during that time. So we're going to have to make up the difference with productivity, and also with the innovations and technologies it will take to actually drive productivity versus adding more headaches to everyone's lives. And frankly, we in healthcare have no choice but to be a part of this, not just because we are a fifth of the economy, but also because we're lagging every other industry in actually being able to harness the tools of productivity. And frankly, when it's all said and done, I doubt that any of our kids will be willing to wait 10 years, much less 40 years, to see meaningful improvements in their quality of life and their standard of living. I doubt they'll be okay waiting 30 days for a doctor's appointment when they can get a package delivered by drone in 30 minutes for almost anything that they can think of, no matter how complicated. I doubt they'll be okay going and sitting and waiting for 90 minutes in a physician's office for an appointment that's 10 minutes long, when they can get a consult instantly on a device for any other type of professional advice. And that's okay. That's actually great. That's what tells us that all of us in this room need to get moving. That's what tells us that this is not a productivity wish or a productivity desire, but really a productivity imperative. Thank you.